Human skull, so maxillary arch, maxilla, so anterior portion, nasal floor region, canine fossa on these two sides. I'm just showing the anatomical landmarks where we engage our basal implants. Nasal floor, canine fossa region on either side. You can have infraorbital foramen on each side. You can say careful while placing zygomatic implants. So today I'm emphasizing more on the pterygoid region, placement of pterygoid implants. So you can have a look at the extraction socket. This is the first molar. You can have three roots here. Second molar region, and this is the third molar region. That is the tuberosity area. You can see on either side the tuberosity. Tuberosity on both the sides is little curved medially. Okay, so you can have a look. I'll show you the anatomical structures more. So continuing with the tuberosity, this is pterygoid process, lateral pterygoid process, medial pterygoid process, and the pterygoid fossa. So this is the pterygoid fossa where you need to engage your pterygoid implant. Okay, in the same way you can see on the left side also. This is the pterygoid fossa. Coming to the main important part where we engage our pterygoid implants, so that is Pterygopalatine fossa. That is Pterygopalatine fossa. So this is the area, Pterygopalatine fossa. Have a look. This is the fissure, pterygomaxillary fissure, which gives rise to Pterygopalatine fossa. Fossa is the space area where we get the bone to engage our pterygoid implant. You get D1 or D2 kind of bone, cortical bone with maximum stability and anchorage you will get. So this is the fissure, pterygomaxillary fissure. You can have a look. This is the fissure which gives rise to fossa. Fossa is the area where you are going to engage your pterygoid implant. That is the area between the fossa is the area between the lateral pterygoid and the medial pterygoid. This is the area. So I'll tell you the osteotomy. So whenever you placing the pterygoid implant, that can be, you can place one pterygoid or otherwise double pterygoid, single pterygoid or the double pterygoid. If you have enough space on the bone, you can place double pterygoid, or otherwise you can place single pterygoid on either side. The purpose of placing pterygoid implant is to avoid the cantilever effect in full arch cases, and also to do any other procedures related to the maxillary sinus. You can avoid all those procedures, that is sinus lift, augmentation procedures, that can be avoided. So directly you can place your implant in the posterior part, that is the terminal end of the bone. Okay, this is the pterygoid region. So start your osteotomy from the distal root of the second molar, more buccally, and you point it towards medially. The angulation may be 40 to 45 degrees. Okay, this is your maxilla. It goes this way, it goes this way, like this. It has to enter the fossa, then only you will get that good anchorage and stability. So through tactile sensation you can place, you drill for some distance, feel for the bone, then you go further. You can place up to 30 to 35 mm. Be careful, it should not be more than 40 mm length of the implant, because you will get maxillary artery there. That is internal maxillary artery, which is a branch of carotid artery. It comes here in this region, more towards the lateral pterygoid plate, but our direction will be like this. Usually we won't touch that maxillary artery, but don't go beyond 40, I mean between 35 to 40. It usually emerges here. So maxillary artery, that gives three branches, one branch to the maxilla, one branch to the temporal fossa, and another one to the mandible. So this is the anatomical structure of important to place your pterygoid implant. This is the pterygoid fossa. This is the fissure and this is the fossa, and the implant should engage here. Okay, so you can place a single pterygoid or double pterygoid. So this will be the terminal anchorage in your full mouth rehabilitation case, where the advantage is that no sinus lift, no augmentation procedure related to the maxillary sinus, and then no cantilever effect. Since you have placed the last implant in the pterygoid region, you will get good stability from the last implant. That is the thing. Thank you.